Hello guys, this is Dr. DeShavo. We are back. We're into chapter 3. We're going to talk about some blood. Mwahaha. I'm not a vampire, I promise. But I did put little pads in there. I thought those were kind of funny. I don't know. I always try to look for little things to help make you guys laugh a little bit or maybe help you remember what we're talking about. So the fancy word is hematopoietic or poetic, depending on how you pronounce it function. And blood is important. I think, all joking aside, remember please that blood is like an organ, basically, unto itself. It's truly a tissue, but it has so many functions in our body, it almost functions as an organ. And so it is important to understand these basic concepts. This is bread and butter stuff. This is stuff that you'll deal with every day, checking people's blood levels to make sure that they're normal, and such an easy way to test to make sure that someone is healthy. So the process of forming blood, I want you to remember that blood is like a solution. And in a solution, we'll have a solvent. And the solvent for blood is going to be plasma, and the majority of the plasma is water. And then the solutes will be the red blood cells, the white blood cells, platelets, macronutrients, micronutrients, hormones. There's a ton of stuff that travels through our blood. If you think about it, whenever we need to transport food, nutrients, oxygen somewhere, we use blood. But don't forget too that we use blood to get rid of wastes and carbon dioxide and byproducts of metabolism. So our blood is super important to transport things to and from tissues. Don't forget too, it acts as a buffer. Our normal pH is 7.35 to 7.45. If you remember that through our tissues and our blood on the pH scale, if you don't remember that, pause the tape and go review that, please, because that is an important thing to know. So when we're talking about the bloodstream or the tissues of the body, the pH of them should be 7.35 to 7.45, within that range. In the blood, we have buffer systems, and it's a brilliant place to put it because it helps to quickly respond to any pH changes that could cause abnormal raise or lowering of your pH levels. So in that plasma, we have all those substances broken down, and that's floating throughout the body to get to where they're going. Now, I should have talked about, so we're going to talk more about leukocytes, which are white blood cells. Leukocytes are all the white blood cells. Lymphocytes are a type of leukocyte. Say that 10 times. So we're moving into the big words again, and just to make that differentiation. We're going to talk about the specific white blood cell types and what they do. I have a great slide that the book has for you. We'll do it on that side. Erythrocytes are red blood cells, and these are oxygen maniacs. They are full of oxygen. They travel out to our tissues. They offload their oxygen. They will gather a little bit of carbon dioxide. A lot of it will travel through the blood plasma itself and then come back to the lungs to get more oxygen. So erythrocytes are just super important for oxygen carrying. And when they get damaged or they're not formed correctly because we don't have the proper amounts of, say, B12, they can't carry enough hemoglobin and we get really tired. The whole goal of oxygen getting to the tissues. Let me clarify that. If you can imagine blood flowing out to the tissues, basically it'll go into arteries. Those arteries will go into smaller capillaries. If you don't remember this, we'll go over this when we talk about cardiovascular. But capillaries are the smallest blood vessels. And those capillaries will be where oxygen comes off the red blood cell into our tissues, and we reabsorb carbon dioxide to be excreted back into the lungs. Now, it's important to understand that concept because then at that point, oxygen is put into our body's cells with glucose to make energy. The whole point of getting oxygen out to the tissues is to put it into cells with glucose to create oodles of energy. So we have a ton of energy to study pathophysiology. Okay, so that's jumping ahead a little bit, but just put that into your head. Okay, that's the important reason we're getting oxygen out to the tissues, is to get into the cells with glucose and to make energy. Now, the blood test I'm sure you're familiar with is hematocrit. I'll put a picture of the hematocrit in your supplemental media. This is the amount of blood volume occupied by erythrocytes. So if you draw a blood into a tube to do hematocrit, you'll spin it, and then the solid components, the red blood cells and the white blood cells, will separate out. That'll be about 45% of your blood. 55% will be plasma. It's important to have the proper amount or percentage of red blood cells in that sample, because if you have too few red blood cells, say you're not creating enough red blood cells, you can't carry the proper amount of oxygen out to your tissues for energy. So look at that picture that I've put into supplemental media for you with a hematocrit. It'll show the tube, that you would do the blood draw with, and you'll see 45% will be the solid component with red blood cells and a little bit of white blood cells, and the rest will be plasma. Now, thrombocytes are another word for platelets, and platelets are important because they will help clot areas that are damaged. So if we cut ourselves, for example, or have damage to some sort of blood vessel, the platelets contribute towards that clotting cascade to block up that area so we don't bleed out. So basically, this is happening all day long. We'll build platelets up in different areas of the body, but we have tissue plasminogen activator, which breaks it down. So which I'll get into that in the future. But just keep in mind, we're always creating clots, but we break them down. So these platelets contribute to those clots, but our body's got to have the functional attributes to break them down so we don't form and throw clots all the time. We don't want to do that. That would be a bad thing to do because they could get stuck places. And this is what I am talking about. So hemostasis in general, my goal in talking to you about this is stopping a cut. So a blood vessel has been ripped, torn, damaged, or cut, and we need to prevent blood loss and hemorrhage. We're going to talk about the steps all the way from when you're cut to when your skin heals after the scab has fallen off. That's what I want to talk about with hemostasis. But we can form clots, and I just told you we're always forming clots. We just break them down. If you form a clot, though, and your body has an abnormal, excessive creation of a clot, and our body doesn't break it down, we can throw that clot. We'll see this specifically, or more often, I should say, after surgery, or if somebody's sitting too long. For example, they can throw a clot, or people that are more prone to it. That clot will travel through the body until it gets to a blood vessel that's smaller. So I say a stroke because that's a common place that it can go, is up to the brain, and it'll travel up to the brain until it gets to a blood vessel that is smaller than it is, and it will block that blood vessel, and anything after that, any tissue beyond that, doesn't have a blood supply anymore. So here's our blood vessel. If our body doesn't break this clot apart, here's this clot trucking down the highway, and this blood vessel is turning into a couple smaller blood vessels. Well, you can see this clot can cut off this blood vessel. And the problem with that is all the blood that travels now through that blood vessel stops. We won't get a blood supply to any of the tissue beyond. So if this is brain tissue, very bad. We can have a stroke. If it is lung tissue, we can have issues with that. If it goes down to the leg, we can cut off blood supply there. So wherever that clot lodges, it'll stop that blood flow beyond it. And that's abnormal. But let's talk about normal homeostasis in regards to a cut or damage or ripping of a blood vessel. So the steps that'll happen is there'll be an initial vessel spasm, and it's trying to decrease the loss of blood. After we form a platelet plug, and I have a nice blood vessel picture for you that shows you the steps of that platelet plug, and I'll explain the components of it and what it does when we get there. So once the formation of that platelet plug covers that opening or that cut, the vessels stop spasming. And the whole reason for that spasm is to decrease a lot of blood getting to that area so you don't bleed a lot of that blood out of your system. Once the platelet plug forms, you'll actually have more coagulation. Well, you'll have platelets and red blood cells join onto that platelet plug to form more of a clot in that area. That clot will retract, bringing the tissue, healthy tissue, closer together, and then it will start to heal, and the clot will start to break down, and new tissue will reform in that area. And what happens during that process that's a big factor of getting rid of the old tissue and developing new tissue is that macrophages come in and eat up the debris, dead tissue, any infectious agents, and fibroblasts kind of follow right behind and form new fibers that establish the matrix of that tissue. So here's a clot formation. You can see there's a cut there. You'll actually start to get platelets and red blood cells and little fibers called fibrin. And I'll tell you what fibrin is in the next slide, but at this point they've been turned active and they form basically fibers. And those fibers form a mesh network in which the platelets and the red blood cells get attracted to, and all of them move towards that opening. Clotting factors I'll explain in the next slide as well. Move to that opening to block it up. Now, clotting cascades is these clotting factors, and there are several steps to this, and it's very complicated, and they come in and they go out, and we're going to keep it really simple. We're going to keep it to the end steps. And you can see to the right here, I've put the steps for you, 1 through 5. Okay. Now, I'm going to jump ahead a little bit and then I'll back up. Thrombin. Okay. Thrombin activates fibrinogen to turn into the active form of fibrin. And let me tell you why we have inactive and active forms. If we had fibrin floating around activated in our bloodstream all the time, we'd be forming clots left and right. What we do is we store it as the inactive fibrinogen. And in order for fibrinogen to turn into fibrin, we need the active form of thrombin. And when we are not using thrombin, it is stored as the inactive prothrombin. Okay? And then you could back up the cascade, the clotting cascade, and work your way backwards through all those factors. We're not going to do that. We're going to keep it to those last 5 steps there. Okay, and platelets aren't really truly a part of it, but platelets will actually attach to the fibrin and help to form that clot. So let me reverse it now. You cut yourself, there's damage. The clotting cascade begins here. There are several complicated and convoluted steps that, thank you, Dr. DeShapo, we're not going to use. Hey, you're welcome. They come, if you want to look it up, have at it. They come down, they go through several steps. The steps that I want you to know is prothrombin will be turned into thrombin. Thrombin activates fibrinogen to turn into fibrin. Fibrin forms those fibers that go over the clot. Platelets attach to that fibrin. Red blood cells, I would add into here, attach to the fibrin. And they all cover up the cut or the damage and form a clot, anatomically known as a thrombus. You can see the thrombus at the bottom there. And yes, we can form thrombi that are abnormal, but we're just talking about it in this case with this clotting cascade. Okay, so that is a very nitty-gritty basic with a clotting cascade. If that doesn't make sense, by all means shoot me an email. I'd be happy to help you out. But let's keep it a little bit simple. You got it. It is question time. So, the correct short order of the creation of the platelet plug is A, B, C, or I'm not going to read them all. So, you tell me the correct order, and then when you are ready, you can move on. White blood cell disorders, fighting the good fight. So, we have white blood cells that help to fight off infectious agents. Overall, they're known as leukocytes, and they're the key players in that inflammatory response and in fighting infections. If we were to look at a normal range, we're going to have approximately 5 to 10,000 per cubic milliliter of blood. Okay, leukopenia is a decreased level of white blood cells. Leukocytosis is an increased level of white blood cells. So you may have some sort of disease process going on, or maybe you're on immunotherapy, you're going to have a lower amount of white blood cells. Penia in general as a suffix means thin or fewer, just so you know. Okay. And an increased level could denote that you're fighting an infection. And if you know what type of white blood cell is increased, you can actually tell what type of infection it is. It's magic, or it's science. Here's our summary of blood cells. So here's your white blood cells. I'm going to talk about red blood cells kind of separately, but let me just give you the once over. Red blood cells are anucleate, which means they have no nucleus. So on this graph, I'm going to kind of underline things that are important. Red blood cells are also biconcave discs, which mean they look like a little Werther's candy. If you've ever gotten that caramel candy that's hard and it has indentations on both sides, this is what a red blood cell looks like. In a cubic millimeter, there's 4 to 6 million. And when we're talking about white blood cells, we're going to talk about milliliters. So don't get confused about that. Don't worry about it. Okay, so lifespan's about 120 days, and then it'll be eaten up and we'll create new ones. Transports carbon dioxide and oxygen. Primarily oxygen is the one you want to remember. Neutrophils. Okay, now as far as numbers, that's probably something that you need to know. I am not going to require you to know all these different numbers. What I would like you to know is the most to the least. And the easy way to remember this is a silly mnemonic, so get your pens out, because there's no way I could write this. Never let monkeys eat bananas. The greatest percentage, about 70% of white blood cells that we have in our bloodstream are neutrophils. About 30% is lymphocytes. About 7-ish%, give or take, is monocytes. About 3% is eosinophils. About 1% is basophils. And that's important to know because we're primarily exposed to bacteria. Well, guess what we have the most of? Neutrophils to fight off that bacteria. Lymphocytes, you can put right over here, and I can't believe they don't have it. Viral. Lymphocytes are the next most prevalent. They help with viral infections. And we already know about T cells and B cells because of stunning immunity. Monocytes turn into macrophages. Those help to phagocytize bacteria and dead cells and cellular debris in the body. Okay. Eosinophils. We'll see these with antigen-antibody complexes and parasitic infections. Basophils, which are closely related to those mast cells that we've talked about, release histamine. And histamine happens during a response, an immune response, where we vasodilate blood vessels. So as far as these numbers, I don't care if you know the numbers. I care if you know most to least. So never let monkeys eat bananas tells us that we have most neutrophils as white blood cells, then lymphocytes, then monocytes, then eosinophils and basophils. So my point in telling you that, other than torturing you, is if we have an increase in eosinophils, we're having some sort of antibody-antigen response, or, oh, God forbid, a parasite. If you have an increased percentage of basophils, so instead of 1%, say it's 3%, you could be having some sort of inflammatory histamine response, or histamine response to an inflammatory condition. If you have 80% neutrophils, you're fighting off bacteria. So what we used to do is we actually used to do a little smear of blood when I studied this, and yes, they tortured me, and I had to sit with that smear of blood and start in the upper left-hand corner and literally count 1 neutrophil, 1 eosinophil, 1 lymphocyte, etc. And after that, you tally it up and see if you have that breakdown approximately of 70% neutrophils, 30% lymphocytes, etc. If you don't, you're probably fighting off some sort of infection. Here's how leukocytes, which is a white blood cell, kind of sneak out of the blood capillary. Remember I told you a lot of the interfacing between our blood and tissues will happen at capillaries. And it does so because if we look at this picture, capillaries are only 1 cell thick. This is 1 cell. So it's very easy for things to sneak out. And these white blood cells with infections, actually the cells of the capillary will shrink a little bit and they create a little bit of space. And leukocytes can sneak between these cells and get out to the sites of infections. Neutrophils are one type of leukocytes. They're usually the primary one to arrive at the site of infection. They're the largest percentage-wise out of our white blood cells. I spoke about all of this already. They fight off bacterial infections. So neutropenia is a decreased count of those neutrophils. Could be you've had a huge immune response, your body's tired, drug suppression, radiation therapy, congenital conditions, cancer, spleen dysfunction, vitamin deficiency. I'm kind of buzzing through this because I think this makes sense. So obviously, in general, you wouldn't be able to fight off infections. You'd have fever, you'd be tired, you'd have chills, you'd take their blood, they'd have decreased neutrophil levels. You could do a bone marrow biopsy because there might be something wrong with their bone marrow. You could give them antibiotics if it's just an infection, or if they have some sort of destruction to their bone marrow, you could add growth factors to help them rebuild that bone marrow, excuse me. And here's a neat little picture that shows a neutrophil sneaking through, and once again, this is the capillary. Here's our neutrophil. Oop. Here's our neutrophil sneaking through that capillary. So it's getting out of the capillary, it's getting into the tissues of the body, and it's grabbing that bacteria. And you can say, oh, that's neat. Like grabs it and brings it in, breaks it apart, and adjusts that bacteria and kills it. It also releases toxins that'll destroy bacteria in the immediate area as well. Pretty cool. You got it. It is question time. I can't help it. I gotta say it that way. Neutrophils best help to fight which type of infection? A, B, C, D. That is it for this first video on blood. If you have any questions, by all means, shoot them to me. I will see you in the next video.